Hello, my name is Neptune Ambrose, student at Rasmussen College. We're going to be presenting today on my final project on image quality. I chose image quality because it's a very broad subject. It's important in the field of radiography, and I previously wrote a paper on the subject, and I wanted to learn more. The quality of a medical image is determined by the imaging method, the equipment, and the variables selected by the radiographer. Image quality is comprised of several factors. This presentation will cover some of the main factors: contrast/brightness, noise, scatter, spatial resolution, and artifact. Contrast/brightness. Contrast is the shades of grays displayed on the image. Increase the number of shades of grays brings up the contrast. Radiographic contrast describes the difference in photographic density in a radiograph. The contrast between different parts of the image is what forms the image, and the greater the contrast, the more visible the features become. Absorption differences within the subject will affect the level of contrast in a radiograph. Contrast continued. The radiographic density levels in digital film are described in levels of brightness. An image that is too bright can be corrected in digital imaging easier than an image that is too dark. Generating X-rays using a low kilovoltage will generally result in a radiograph with high contrast. Low energy radiation is more easily attenuated. The ratio of photons that are transmitted through a thick and thin area will be greater with low energy radiation. This in turn will result in the film being exposed to greater and lesser degrees of the two areas. Here are some contrast examples. This is the optimum amount of contrast that you would want on a radiograph. Noise. Quantum noise is not used for diagnostic information. Noise only serves as a distraction. And the X-ray photons hit the image receptor in a random pattern. No force can cause them to be evenly distributed over the surface. One area of the receptor surface might receive more photons than another area, even when both are exposed to the same average X-ray intensity. Here are some examples of images with different levels of noise. Imaging procedures using X-ray photons. Most of the image noise is produced by random matter, in which photons are distributed within the image. Each individual photon is a specific quantity of energy. The quantum structure of the X-ray beam creates quantum noise. Noise is visible through the fluctuation of density on the image receptor. The more photons that reach the image receptor, the less noise there will be. Scatter causes unwanted density to the radiographic image. It does not provide useful information. Scatter occurs on both soft tissue and bone tissue. The energy of the X-ray beam, the higher the energy of the X-ray beam, the lower amount of scatter that will be. Digital image receptors are more sensitive to scatter radiation than film, since they pick up low levels of radiation easier. Use of a grid will help limiting scatter. Here's an example with a grid, here's an example without a grid. The grid limits the Compton interaction and more information reaches the image receptor. Spatial resolution. Spatial resolution is the ability of a radiographic image system to record detailed images. In many cases, digital image cannot accomplish resolution of film images. Low spatial resolution techniques will be unable to differentiate between two different objects that are relatively close together. The greater the number of pixels per unit area, the better the spatial resolution. Any undesired image on a radiograph is considered an artifact. The presence of artifacts can cause an inaccurate diagnosis and cause the film to be retaken. Artifacts are pretty simple as far as getting not having them in the picture, but it's with communication with your patient that will cause you to not have artifacts. Here are some different artifact examples. Some artifacts can be just pushed to the side. Others you may have to ask a nurse or the doctor if you're able to remove them to take the image. All right, related case studies for image quality. The case study I chose was about how tempered glass has condensed X-ray beams in a very small dimension, achieving excellent spatial resolution. Here's the article. If you click the link given, you will be able to read it. Today we do not have time to go over this in detail, unfortunately. ARRT concepts. Uh, the the concepts in this presentation that are relevant to the ART exam are found on page 8 of the registry concepts. And some of the main points are contrast/brightness, scatter, and spatial resolution. A better knowledge of these subjects will actually aid you on the registry, and it's actually listed there as some of the concepts that you need to know to help pass the registry. This is linked to the exact section that has the image production. That's the image production section on page 8 of that PDF file. A quality radiograph image accurately represents the area of interest and provides the radiologist with the necessary information needed for diagnosis. Using the appropriate settings to minimize the patient exposure and re-exposure will go a long way in the patient's safety. I personally learned that there's a lot that goes into producing a quality image beyond the technical settings such as KVP and mass. I also will apply this knowledge of these factors during my clinical this quarter. And I actually had a situation where we were taking a portable image and the person had a chain that was on top of their shirt. We had them remove that chain, but little did we know, he also had two other additional necklaces under the shirt. With appropriate communication, we would have been able to see that and not have to retake the image and cause patient that extra dosage. Thank you for your time and have a great day.